So last time we discussed how extended release tablets and capsules are made, but how about extended release patches? It really boils down to the type of polymer that you're going to use to actually control the release rate of the drug. By adding certain polymers, you could actually slow the rate of the drug leaving the patch and entering into the body. And by doing this, you can allow for a constant release rate of the drug over multiple days. So you can essentially load a patch with 7 days worth of drug doses, and by adding a specific polymer, you can make it where the patch releases a small amount of the drug over time, so that it essentially lasts for 7 days in this case. So the polymer that you see most often being used in patches nowadays would be acrylates. Acrylates refer to a specific class of polymers that are used across a wide variety of industries because of their great adhesive properties. A common example that you might have lying in the drawer would be super glue. So they have found their way into medical patch formulations because of a few advantages. One, they can mix great with a lot of drugs and have great solubility with a lot of drugs. They're very stable at a lot of different temperatures. They have great adhesive properties, and they can be very well tolerated by the skin and can be very easily peeled off and not leave any sort of rash or irritation like other polymers might have. So what happens is that the drug would be mixed with the acrylate and will form this sort of complex where the polymer makes bonds with the drug itself, and now you have the situation where the drug is mixed in with the polymer, and then once the patch is applied to the body, the drug, wanting to diffuse itself, go from where it's at its highest concentration to its lowest concentration, it wants to leave the patch and go to the body. But because it's bonded with the polymer, it's going to have a harder time actually leaving the body, and that's going to be what slows the release rate of the drug, as it has to actually disconnect from the polymer and then it could travel into the body. Some other polymers that you might see in a lot of different formulations be stuff like silicone polymers or polyisobutylene. They work in the same way, it's just they do not have the same advantages as acrylates. So some common examples of extended release patches using acrylates would be Catapress, which is a clonidine patch used to help control blood pressure, Utrans, which is a buprenorphine patch that's used for pain relief. And you also have Sancuso, which is a granisetron patch that's used for nausea and vomiting. Join me for next time as we talk about how injectable formulations are made into extended release formulations.